Let's take a step back and think about what we mean when we call something an experiment. When we talk about research, there's different terms that get thrown around. Research can be described as descriptive, exploratory, or experimental. And the distinction here is based on whether it's describing practice as it is or practice as it could be. Descriptive research is describing an existing population. Exploratory research is generally describing the effects of current practice. And experimental research is generally describing what are the effects of potential new interventions. Descriptive versus exploratory, when we describe research, descriptive studies are describing what is. They're taking some population and measuring something about it, describing something about that population as it is without any kind of intervention. They're not looking for a change as a result of something being applied. An exploratory study is generally describing the results of an intervention as part of regular clinical practice. The distinction between exploratory and experimental can be a little fuzzy. The idea is that exploratory research is describing either natural changes or changes from clinical practice that we aren't changing in some way, that is not novel or outside of usual care. Experimental research, here we're trying something new, something that isn't part of regular care. However, every kind of experiment, whether it's exploratory or experimental, has three things in common. There's a defined population that you're sampling from, some sort of intervention or exposure that can be usual care, it can be something brand new. That's your independent variable, the thing that you're changing. And then the dependent variable, that's the outcome that's getting measured. So the independent variable, that's what you're manipulating. The dependent variable, that's how you're measuring the result of what you manipulated. So another way to think about it, scientists use the independent variable to cause changes in the dependent variable. Now, your independent variable can be either an attribute or an active variable. An attribute variable is something you observe. So that may be height or age, right? You may be interested in does age have an impact on how people react to a drug? So in that case, you can't assign people ages. So that's an attribute variable, something you observe about them. You can still determine whether there's a difference in how people react to that drug or that treatment based on their age. An active variable is something that you can choose or actively manipulate. You can give somebody different dosage of an intervention or different intensity and see if that affects their outcomes. So both of these things can be manipulated in the sense that we can see how they affect the outcome variable, but only some of them can be actively manipulated.